Be careful, write down the notes. If not, go to the YouTube and write down afterwards, who is this Redmi? Can you please give me your name, because I cannot call you Redmi, because I don't teach for English to computers, I teach to people. So be careful, write down the notes. If not, go to the YouTube and write down afterwards, who is this Redmi? Can you please give me your name, because I cannot call you Redmi? Yes. Because I don't teach for English to computers, I teach to people. So be careful. So drag as many people as possible. No mercy. It's an order. Everyone should attend, and make a list of those who attend, and those who did not attend, make a list of those students also, of the regular students. I want the data. Okay. So that I can scourge them. So they're not serious, we can exclude them. Yeah, Rajani Akireddy. Yeah. Yes. All of you, write your first name and second name whenever you come. Okay. Because I'm giving you personalized sessions. So Kamaljit Kaur, we got good results. Now also we have to get good results. Otherwise, don't go for exam. Don't make me ashamed of your results. Anita, yeah, yes, yeah. All of you give your first name and second name. Attendance is being taken. Akhil, you can join the session in between whenever you are available, and you can take the attendance and mark the attendance, those who attended the session. Otherwise, you have to ask them that they have watched the full session later, because this is very, very important. Okay, make me stronger by giving the list. Then only I can handle with them, right? Otherwise, they're playing the fool, hide and seek with me. They're playing hide and seek with me. They're not coming to attend the sessions, right? Just give me the names of the students who are attending, and remaining things, eliminate the names, and then give those, subtract the names, and give me the names of the students who did not attend the session, so that I can take action. Yes, very important session. Do not miss. It's an order from the beginning to the end. The first one will be squamous cell carcinoma for the nurses. It doesn't mean that doctors need not attend, because if the same card is given for the doctors, then how they are going to do? It's important. Squamous cell carcinoma. This is nursing specific. Nursing specific speaking role play card. Yeah, that is number one. Next, we'll take a doctor specific, medicine specific card. Number two, atrial fibrillation. Or you select, again, you select from that future land materials, you select one letter. Okay, fun for the doctors. Take the assistance of your coordinator. Okay. Yes. Right. So check her whether Mira is there. Yeah, Mira is there. Yes, Mira, find out one's card, because I'm busy now. You can find out from card from what's that? Future land, a list of sentences. Select one good card and give it to Akhil, so that he will follow it up. Yes. Right. Now coming to the point, this is, I have muted everyone. Okay. It's a military system. You know that very clearly. And this is the patient's card. And I'll give both the cards here. So you, it will be at least a half an hour or even more. Yes, this is the role play card. Hide floating meeting controls. Yeah. Huh? Okay, let us take like this. So this is nursing card. Yes, this is the card. Function. Yep. Print screen. This is the patient card. Now onwards, we'll be minimizing the use of WhatsApp. WhatsApp will be scrapped in the short time and we'll be focusing only on the classical corrections. Yes, this is the candidate's card. So this is a squamous cell carcinoma. Okay, so nursing specific speaking role play card, and this is candidate card. Yeah, that is candidate card. Fine. Next we have, it's a, no, that's a patient's card. Okay, role player's card. This is the candidate card. I'm sorry. Yeah, yes, this is the card. Yeah, this is role player's card. Role play, role player's card. Yes, role player card, and this is candidate card. Okay, this is number 5. Yeah, day 5, speaking 5 is speaking nursing. Yes, yeah, yes. Here is the card. Okay, and I'm sending it to nursing group also. Document. Yes, nursing role play card. Day 5, speaking test, nursing center. Yeah, yes, there you are. So, closing the WhatsApp. We'll be minimizing the usage of WhatsApp now onwards. We'll be focusing on Telegram. Yeah. So here is the card. Yes, that's it. You have, say, 3 minutes to prepare. All of you prepare, but then we'll start. All of you prepare for 3 minutes. This is the nurse's card. Even the doctors, imagine that you are a doctor and this is a doctor's card. That's it. Don't think that this is nurse's card. Think that this card comes into your exam and you are doctor instead of nurse, then you have to act accordingly. Akhil, check that squamous cell carcinoma card where it is. Speaking card. We have printouts, no? Squamous cell carcinoma. Speaking card. Otherwise, I'll print it out, no problem. One second. We'll also print a medicine card. So take, have you got any medicine card? No, okay, no problem. I'll take this one. Difficulty walking frame. Okay. Yeah, selected same card from medicine. Okay. Yeah. Yes. You have 3 minutes to prepare. It will be a dynamic participation. I'll be asking you a question and I'll give you one after another. And all the mics, whenever you are speaking, when I call your name, you have to open your mic. There is no breaking the rule, and I don't want any unnecessary background sounds. Don't open the mic if you have background sounds. Please. Okay. So I'm allowing everyone to unmute, but you cannot unmute without Simon sir calling your name. Okay. Yes. Yeah. Akhil, you join the join the Telegram. Sorry, you join the Zoom. Make a list of all the students who are participating, and give me the list. Only them I'll call in order, one by one. They will answer. When I say number one, that means number one. I'll give them the number. or you can give the number yourself in the Zoom. Okay, give the number in the Zoom. Write their number in the Zoom. First write in a paper, then write the number in the Zoom. When I call the number, yes, they will answer. I need not call their names also. It's going to be a dynamic session. It will be a revolutionary session. The world should know what we are doing here. We are not playing the fool like many other people. We have some difference. Quality with a difference. Yeah. So Akhil will give the numbers. You just type your names, that's all. Yeah, Akhil is giving. Akhil. Anitara Pachigola is number 1. Anju Kumari is number 2. When I ask a question, one by one, you will be answering. And don't miss the session. Don't go out of the session. I don't want anybody to go out of the session. If you want to go now itself. And you will not be permitted because I'll close the channel. I'll not allow, even if anybody wants it, they cannot join afterwards once the session starts. Even doctors also you can give. Doctors will participate like doctors only. They'll think that this card is doctor's cards. They should find out what is this grandmaster class, what are they doing. Everyone should start searching. And they should knock the doors of grandmaster class. Give us admissions, and we'll say no, we'll not give unless these conditions are fulfilled. Yeah, Dr. Nemadi, it is for nurses, but no problem. I will ask you a question. You're as a doctor, you are doctor and I am patient. Like the doctors pretend to be doctors. Nurses are nurses. That's all. This is a doctor's card for doctors, nurses card. Only forget about the nurse. That's it. Because next card will be for doctors. Nurses also will participate there. Yeah. So this is the order. Sakirat should be 7, na? You wrote 9. Okay, you can delete that one. Okay, I will delete. Yeah, okay, fine. Yes, come on. Prepare, all of you prepare. I'm going to ask you questions. Okay, everyone will be answering tuck, 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 and everyone will be coming on the video. Those who are coming on the video, they will be given special attention. Okay. Yes, of course. You can take a, if you want, you can write this card and keep it there. Whatever you want. No problem, I don't mind. Yeah. So 2 minutes more. Give names on speaking power only to the regular students. Okay. Not to the guests. This is for my children, not for everyone. They can attend, that's all. They cannot open their. Yes. Make notes. Whatever you want to do, you do. But when I tell the number, automatically, yeah. I'll be asking 1, 2, 3, 4, 5 questions plus 6 and 7. 7 totally. Introduction, conclusion, and 5 points I'll be asking you. You do one thing. Take one paper, take one notebook, and write in this all these names which you have typed there. Write them and make names. Write the names and the column 1, 2, 3, 4. You have to tick whether they are answering or not. Okay, chase it up. How will they not be active? I will see. Okay, what you do is write the number here. roll number, what you have given, and here write the name, and here 1, 2, 3, 4, 5, 6, 7 points. Here 7 questions I'll ask. You have to see whether all of them are answered or not. Yep. So last 30 seconds. Now the first question will be, what is the first question? Yeah, the first question will be like this. Yeah. So 13 members are there, right? So there are some guests also. If afterwards time is sufficient, I'll give you. Otherwise, you just participate. All right. So the first question will be like this. So self-introduction. So introductory scene, the commencement, how you will start introducing yourself. So this is the commencement. Okay, the commencement is called A. Point number A, the commencement. Okay, A is the commencement. Then we will have question 1 is the bullet point 1, which you have to expect bullet point 1. Okay, then you will have question 2. Then you will have question 3. Okay, then you will have question 4. Then you will have question 5. Then you will have the summarization or the closure, the conclusion. So D, and this is called Z, the conclusion, the summing up. We call it as the summing up. That's very nice talking to you. Okay, the summing up or the conclusion, whatever you say. So these are the 7 roles we are going to do. Yes, be ready for that one. The first one will be introduction of introductions. How are you going to introduce yourself? Is this a known patient or not? Okay. What do you think? What type of questions you are going to ask and everything? Yes. Yeah. Prepare well. Yeah. There we are. Right. Now let me see who are active, not sleeping, not in the kitchen, not in the office, not somewhere. Show your faces. Videos on. I want to see I want to test who is really dynamic. Yes. Dynamic. Who are sleeping, who want not to speak, just hide your faces, do whatever you want. I don't mind. Who are dynamic. Participation. Yes. So you have gone through the card. And this is a nursing card. Squamous cell carcinoma. Have you got the list, Akhil? Have you written the list? Yeah, I have to tick mark. Ne? Have you made up 7 columns? So from next time onwards, you can keep this ready, okay? You need not, yeah, you can put a scale and just mark lines like this. Okay, just give it fast. Yeah, so we're starting with Anita. Right. So everyone, what about the others? What about the videos? Yeah. Now, you are going to start. So Hafsa Fatima is at work. Okay, this is how I find out. This is how I find out. Right, good, no problem. She's a good girl, no doubt. If I say don't sleep also, she will not sleep. She will work harder. Okay, when I say good, I mean it. Till now, she did not ask me even one question. Okay, never. Whatever I said, she did. Yes, sir. She never asked why not, why this, why that. Never. That's the level of obedience. In the same way, there are many other students also. I cannot name everyone because I saw her, I'm telling. Yeah. So, Anita Pachigola, yes. How are you going to start your discussion? You can unmute. So, unmute. Yeah. You can unmute. Anita Pachigola, now it is your turn. Yeah. Anita Pachigola, you can unmute. What happened? What's happening? Why are you not able to? Yeah. Yes, come on. Vijay, you can, only when your name is called, you have to unmute. So this is Anita Pachigola. Yes. How are you going to start?
Good afternoon. My name is Anita Pachigola.
Continue.
My name is Anita Pachigola, one of the registered nurses working in this clinic. I would be extremely pleased to know your name and age and purpose of your visit today to this clinic.
Right. So I'll give the answer. Whatever I'll give the answer, that's different thing. Yeah. Next, Anju. Anju.
Yes, sir.
Yeah. Start your video. Yes.
Yes, sir.
Yeah. You can start.
Do you have any knowledge about the squamous cell carcinoma? It's a type of cancer. Do you know about anything?
Yeah. That's good. So this is beginning. You are commencing. You are introducing the topic. You are introducing. So you are introducing yourself, or you are confirming whether. So, for example, you can ask like this because you are a new student. Yeah, you are a new student. So that's why how you have to introduce yourself. Right. I am. Hello. Good evening. Come on in. Please have your seat. Thank you for visiting us. By the way, my name is Abraham Lincoln, and I am one of the registered nurses working in this department. I am pleased to see you here. What brings you here? Even the doctors, you add them. No excuse. There is no doctor, there is no nurse. All are students. Everyone has to learn. I am teaching for everyone. It's an open lecture. Okay? Write in the WhatsApp groups. Everyone, all the students. I don't want anybody to miss this session. And those students who miss this session will be punished without reason. If they are working, let them tell you that they are working, so that we'll confirm that later. Simply paying the fees and not attending the classes. Yeah. By the way, what brings you here? How come you are here? What's the reason for your visit? Would you please tell me what brings you here? How can I help you? I'd be thankful to you if you can let me know your name, age, and the reason or the purpose of your visit here to this clinic. I would be pleased if you can provide me some basic information. No need to write anything. Everything will be in the YouTube there. It will be transcript will be there. Go there and click on the transcript. You'll get all the transcript. Every word to word will be taken down there. Then you can note down word to word, type it and it will come. Whatever I'm telling you in the YouTube transcript. So no need to write anything. You can take all the words, copy them and use them as they are. You cannot write so fast. So don't worry. The notes will be taken. Yakil, gather all the notes, edit everything and put it in this, right? Every student sentences will be there. Everyone's sentences will be there. This is going to be a powerful explanation. It is a divided but shared information. Everyone speaks many different sentences. All these sentences you can take. Oh, Anju has given this wonderful sentence. So I can use it. So use it. For example, Mr. Peter Simon has made a blunder. It's a mistake. So this is a mistake. Can I identify that mistake? Why it is a mistake? And write that sentence. Anybody has done any mistakes, write them. Okay, you can take from the YouTube, write them. And then why it is a mistake, you can prove. This is the way of learning. That is how I learn. That is how I learn. Learn from others' mistakes. You don't commit any mistakes. When you listen to everyone, you'll get hundreds of sentences. Try to find the faults, not in real life. Oh, that is like this is like this, he is like this, he is like this. Forget that. Don't find faults in others. Try to find the faults in the sentences of others. This will be productive lifestyle. It's not criticizing lifestyle. In real life, people criticize. My sister is like this, my brother is like this, my uncle is like this, my husband is like this, my wife is like this. Nonsense. They are raking my brains. No. Don't judge people. Judge their sentences. Hate the sin, not the sinner. Mahatma Gandhi told. Somebody does some mistake, don't hate them. Okay. Hate the sin, not the sinner. Somebody is doing a sin, don't hate them. Hate their sin. For example, somebody is stealing. Hate stealing, but do not hate the person who is stealing. Start loving him. Start training him. Start telling him. Correct him. Mend him. He will become your best friend in your life. Now what you have to do? Don't find faults about others. Try to find the faults in the sentences of others. And write down number one. Number one, he has underwent surgery. He has underwent surgery. Can anybody give the sentence? Correct it. He has underwent surgery.
He underwent.
He underwent surgery. That's good. Anju, excellent. I'm proud of you.
Yes.
So, he underwent surgery or he has undergone surgery. Both are correct. Has undergone is present accomplished. Underwent is past accomplished. That's it. Now we are going to increase our strength now. There will be hundreds and there will not be any place. I told you, we are shooting stars now. Yes, Anju, next time be ready with your sentence. Right. Can you give one sentence? Can you start now? I'm giving you another trial. After listening to all my sentences, can you give 2 or 3 sentences how you are going to commence your speaking session with your patient? Yes.
Sarvam is starting.
Yes.
Good afternoon. My name is Anju, one of the registered nurses working here in this clinic. Please have a seat. May I know your name to start the conversation?
Very good. That's enough. That's a good start. Earlier, you were talking something else. This is a good start. Right? Do it. Practice regularly and you will improve.
I thought, sir, she started salutation greeting, so I have to ask question. That's why I directly asked.
Only one question. I am asking question and everyone is doing the speaking. That's all. You are just nurses. No problem. Okay, no worries. No worries. So next one, Hafsa. Hafsa. Which Hafsa? Hafsa Fatima or Hafsa Irshad? So write down the second name, Hafsa Fatima. Yeah, Hafsa Fatima. Yes.
Yes, sir.
Yes, share your video. Yes, come on.
Yeah.
How are you going to introduce or commence the session? Beginning of beginnings.
Good afternoon. I'm a registered nurse. My name is Hafsa Fatima. Would you mind sharing me your name and age, please, for the record purpose?
Yes. For the purpose of official documentation, I would be pleased if you can provide me or if you can furnish some basic details such as name, age, and the purpose of your visit. I'll give number of corrections like this. Akhil, come here. This is my oldest student, Budwin Chawla, physiotherapist. Okay, tell her studies in a session and he'll get back to you as soon as possible. Call and tell. Okay. Yeah. Yes, she was one of my assistants earlier. Hafsa Fatma, very good. Your sentence was good, but it needs improvement. It's not wrong. Basic style. I gave the A grade style. Write those sentences which I'm telling you. No need to write.
Yes, I am.
Copy it from the YouTube afterwards. I'll give you. Yes, please. You wanted to say something?
No, that's fine.
Yeah, next, Kamaljit Kaur. Kamaljit Kaur.
Yes, sir.
Yeah, can you share your video, please?
Okay, sir.
Yeah, I'm bringing some standards. So all of you are very obedient. You can definitely come on. No problem. Yes.
Good afternoon, sir.
Yeah, go ahead.
Hi, good afternoon. Please have a seat.
Complete.
Please have a seat. Okay, I'm Kamaljit Kaur, working in this clinic. And for the better communication, may I have your name and age, please? Okay, Mr. John, from your case note, I came to know that you are here for the stitches removal because you was diagnosed with squamous cell carcinoma and your lesion has been removed. Am I right?
Yes. So here you started with the word hi. Hi is an informal word which you use for talking to your friends or relatives or neighbors or somebody else in an informal setting, but not in a formal and official setting like an OET interview or in the realistic official. So you'll not do that.
Okay.
You'll not talk to your patient saying hi or hello. These are informal styles. So don't greet your patients. There are only 4 things. Good morning, good afternoon, good evening, good night, or else good day. That's it. These are the things what you have to do. Only these are the 4 things. Good morning, good afternoon, good evening, good night. There are other words. Fine, everything. Next, Majid. Majid. Mr. Majid. Muhammad Majid. Are you there? He left actually. Okay, next. Rajani. Rajani. Which Rajani? Akireddy Rajani. Oh, I forgot her name. See? Rajani. Yes, Rajani. Rajani also left. Okay. Next. Rajeshwari. Rajeshwari. Rajeshwari, unmute and start your video. Where are you? Yes. Rajeshwari Sarvegar.
Good
Yes.
afternoon. Good afternoon. My name is Rajeshwari. I'm the registered nurse working this clinic. If you don't mind, can you please provide your name and age for my documentation purpose? Nice to meet
Yes.
you. From your record,
Yes, that's good.
From your record, I understand here to for your stitch removal and clean the wound and dressing. Is that right?
Right. Okay, fine. Akhil, follow up with Majid and Rajani. Get them back, put them back, throw them back into the session. Next, Sakirat. Sakirat Yusuf. Sakirat Yusuf. Can you start your audio and video, please? Oh, sorry. Sakirat Yusuf. Yeah. Yes, please, Sakirat Yusuf. Come on, start.
Okay. Good afternoon. Please be seated. Nice to meet you. I'm Shakirat, one of the nurses working in this clinic, and I'm the staff on duty. I understand you had the surgery done and you came for a silver. Is that correct?
Yes, of course, nurse. I really appreciate, I cannot but appreciate your confidence, level of confidence. The little you spoke, but you spoke with the, that command.
Okay.
I really appreciate that for that. Yes, next one, Sharon. Sharon. Sharon, once you finish, you can stop your video and stop your audio. All of you.
Okay.
Good afternoon. Please be seated. I am Sharon, one of the registered nurses working in this clinic. Before going further, may I know your name, age, and reason of your visit, please?
That's a good turn. There was some sort of, style in your speaking, but that fluctuation is missing. It was a flat tone, but that was really good. Next, Viji.
Thank you, sir.
Viji. Yeah, I'll get back to you, Hafsa. Viji.
Good morning.
Viji, can you start your video? Yeah, you can start.
Good morning. I'm Vijay and I'm one of the registered nurses working in this clinic. Please be seated. For the verification purpose, could you please provide me your name and purpose of your visit?
Yeah, thank you very much, nurse. The next one. Next one is Vinita. Vinita Mol Ramakrishnan. Yes. Vinita.
Yes, sir.
Yeah, Vinita Mol. Can you start your video, please? Vinita Mol Ramakrishna. Yes, you can start.
Good afternoon. Good afternoon, Peter. Please have a seat. And nice to meet you. My name is Vinita. I'm a registered nurse working in this clinic. Okay. And from your case note, I understand you underwent surgery followed by squamous cell carcinoma. So today you are here for dressing and stitch removal. Am I right?
Yes, nurse, you are absolutely right. So
okay,
next
could you
is
please tell?
doctors. Yeah, carry on.
Could you please tell me if you have any concern regarding squamous cell carcinoma?
Yeah. So Dr. Swati. So you're a doctor and I am your patient. Come on. Dr. Swati Nemade. Dr. Swati is not there. Okay. Next, Manimoli. Manimoli, I got you, Manimoli. Every day I was trying to check for you, and you're missing, and I'm old man and I forget things. No, you're spared, but today you got, yeah, Manimoli. Yes, Manimoli. Yeah, you can start.
Good afternoon. Please have a seat. How are you? You're okay? Okay. I am the nurse, one of the nurse working in the clinic. That's it. No, I didn't read the book.
Yeah, no problem. No problem. You can learn from others how they are speaking all the sentences, and you can create your own style. Okay, you can watch this video later and you can develop your own style. Listen to everyone. Afterwards, you can write with good sentences and you can create your own style.
Yeah, I
Next
didn't
one,
read
Yogendra. 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 Yes. This is the charming young man. Come on. At least I have some men here.
Good morning. My name is Yogendra. I'm one of the registered nurses working here in this hospital. For reconfirmation purpose, could you tell me your name and age, please?
Yeah, that's very good. Good presentation. You are speaking very nicely. Earlier you are shy, but now you have overcome your shyness. That's very good. Who is the next one? Dr. Arshia. So those who have finished, you can stop your video and you can stop your audio also.
Hello.
Yeah, Dr. Arshia, can I see your video, please?
Yes, sir.
Yeah, please start your video. Yes, come on, start.
Hello. Good afternoon. Dr. Arshia here. Please be seated. I am one of registered doctor here in this clinic. And for confirmation purpose, could I know your name and age, please?
Yeah, that's very nice. That's very nice. So you are bold enough. Yeah, but many students I have noticed you are saying, I am one of the registered nurse. So one of nurse one. How can it be one of one? It can be one of many. There are many books. Bring one of them, not one of it. One of them. Them means plural. So one of the nurses. I am one of the registered doctors working in this hospital. Registered doctors. I am one of the registered nurses. I am one of the nurses. So one of many. The rule is one of many. So one of many. So remember that. This is the mistake that is done by many students. Yeah, next one, Dr. Alinda. Those who finish can stop your audio and video. Yeah, Dr. Alinda.
Hello, I'm Dr. Alinda, one of the doctors in the clinic today. I'll be looking after you today. Can you please confirm your name and age for me, please? And can you also tell me the reason of your visit to the clinic today as well?
Yeah, that's very good. Right. So see, somebody is opening the mics, other people who are not participating, they're opening the mic. If you're opening the mic, there is an interruption. So you stop your audio and video others only when you're speaking, because some other names are coming and some other person's video is showing because of the sound, the background sound. So stop your audio and stop your video others. Only the person who is participant will open the audio and open the video. Right. So that's good, Dr. Alinda. You are talking with command and you have a lot of grip on the subject. That's good. You are performing well, no doubt. Yeah. And there are some names I will give you. The names are Dr. Alinda. Then you can take Hafsa Fatima. And there are some other people who are performing well. Yeah. For example, Yogendra, level of confidence, like that. So you can take some sentences based on those things. And there is also what's this girl's name? Mole. What is it? Mole? Vinida Mole. So she also does well. So you can take some examples based on this one. Next one, Simran.
Yes, sir.
Yeah, start your video, please. Yeah, you can start. How are you going to start?
Good afternoon.
Continue.
Good afternoon. My name is Simran and I'm one of the registered nurses working in this suburban clinic area. Please be seated. For my documentation purpose, could you please tell me your name?
Yeah, very good. Next, Hafsa. Hafsa asked me, I will give me another chance. Yeah, one more time. Hafsa.
Yes, sir.
Yeah, start your video. You should remember video and audio. You should start. Tuck, tuck. Yep.
Yeah.
You can start. You have a second turn. No problem.
For this. Good evening. This is Abraham. I'm a registered nurse. My name is Hafsa. Please make yourself comfortable. And would you mind sharing me the reason of your visit here? Because of this sutures remover?
Yeah, that's good. That's really good. So she has given one particular sentence. Please make yourself comfortable. So, please make yourself comfortable. A very good sentence. So you can use this sentence. Now we are going to bullet point number 1. I'm sharing the screen again. Yeah, here it is. So the confirmed reason for visits, removal of stitches, wound cleaning, redressing, etc. Find out if patient has any concerns. So this is the point which you are going to discuss. So this is the point which you are going to prepare for now. So this is the point number 1. So you have to speak about this. Yeah, prepare your notes, prepare whatever you want, everyone. Learn from everyone. Yeah, Rajni has come. Rajni. Yep. Aki Reddy Rajni. She's there, right? She's there, I think. Redmi has come. Redmi means Aki Reddy Rajni, I think. Is it Rajni? Redmi? Redmi. Is this Aki Reddy Rajni? Okay, then next one is, who is this? Majid. Muhammad Majid. Yeah, Muhammad Majid. Yeah, Muhammad Majid. Unmute. Yeah, start your video, please. Now, how are you going to introduce yourself? Everyone has introduced. You did not introduce. Come on.
My name is Muhammad Majid. I am one of the registered nurses working with.
One second. You can start now.
My name is Muhammad Majid. I am one of the registered nurses working in this clinic. How may I address you?
Yeah, good. Good. So next one, Rajni. Rajni. Dr. Swati. Swati is not there, okay? Right, Rajni. She's there, I think. Redmi is there. Hello, Redmi. What's your name? Can you type your name? Unmute. Okay, fine. So that's it. Sir, I'm back. I'm having internet issue. Okay. Right, unmute, na? Yes. Yeah, very good. Now you can start. Yeah, Rajni, you can start.
Good afternoon. My name is Rajni Akreddy. I am one of the registered nurses working in this community health center. Please be seated. For confirmation purpose, could I know your name and age, please?
Yeah, very good. Very good. Excellent.
Thank you, sir.
Right, now we are moving to the second part. The first point here. The first point here. Yes. So prepare. Try to give your best sentence.
మా సార్ ఇలా క్లాసులు తీసుకుంటున్నాడు.
All of you.
మంచి అబ్బాయి.
Yes. So you have to talk about the confirmation of the visit. So, Akireddy, Rajani. Yeah. Confirm reason for visit, removal of stitches, wound cleaning, dressing, redressing, etc. Find out if patient has any concerns. So how are you going to? I'll give you an example here. Right. So my name is Abraham Lincoln and I have come here regarding the stitches removal. The doctor has suggested me to meet you. So I am a little bit confused. What am I going to? So, okay, then she'll ask you like this. You, the nurse, will ask like this. Yeah. That's nice. You're here based on your doctor's recommendations. You want to learn more about your condition. And then you have come here for the removal of stitches. And you have to ask, what about the wound cleaning and redressing and everything? And would you mind, can I know if you have any concerns? What are the problems that you are facing? Do you want to share any personal information regarding your wound healing? Okay. Do you have any queries or questions or doubts or whatever? I'd be pleased to answer you to the best of my knowledge. And if I do not know, I'll definitely recommend you to have a visit with the doctor, or I'll arrange a meeting with the doctor so that you can discuss openly and you can get first-hand information. All these sentences are already there. First-hand information, and you can learn everything. So this is how you can So based on this information, confirm reason for visit, removal of stitches, wound cleaning. So he has come for removal of stitches, wound cleaning, redressing, and he has to come regarding some doubts or clarification, anything. All these things you can talk. Yes, I'm giving you 30 seconds. Just to rephrase, restructure your things. Yep. So, number one, Anita. So, how many students have participated? 16 students have participated. Anita, Anju. Anita is number one. Anju is number two. Hafsa Fatima, number three. Kamaljit, number four. Majid, number five. Rajani, number six. Rajeshwari, Sakirat, Yusuf, Sharan, Vichi, Vinita. Dr. Swati is not available. Manimoli, Yogendra, Arshia, Alinda, Simran. So, 16 students participated. Yeah. Now, let us start. Yes. Anita Pachigola. You can unmute and you can start your video, and it is your turn now. All others mute.
Shall I start, sir?
Yeah, you have to.
Yeah. Well, Mr. John, that's nice you're here based on doctor's recommendations, and you came here for removal of stitches, wound healing, wound cleaning, and wound redressing. But before proceeding further, would you mind telling me if you have any further concerns or doubts? I would be well pleased to answer you to the best of my knowledge. Do you have any concerns?
That's good. That's a good attempt. Next, Anju. Anju Kumari. Yeah, next, Hafsa Fatima. Hafsa Fatima.
Yeah, hi.
Okay, she's coming now.
Alright.
When
So, would you mind giving me a minute? I'll just go downstairs.
Yeah. Yeah, in the meantime, Kamaljit Kaur. Kamaljit
Yes.
Kaur. Yes. It is your turn, Kamaljit. All of you
Okay,
learn from everyone's sentences. Kamaljit Kaur.
So, Mr. John, from your case note, I understand that you are here for the removal of your stitches, wound cleaning, and redressing. But before proceeding further, would you mind telling me if you have any concern in your mind? I would be pleased to help you out with the best of my knowledge.
That's good. Next, Majid. Hafza Fatma, if you are ready, send type ready. Yeah. Majid, Muhammad Majid. Yeah, Rajni. Rajni. Rajeshwari.
So, based on your case note, I understand that you are here for
Tell a little bit loudly, na?
Based on your case note, I understand that you are here to district cleaner, including leadership. Is that right? Yes, teacher possible for that. Can you please tell me, do you have any questions regarding your condition?
Yeah. So your audio has some problem, I think. Yeah, Sakirat. Sakirat. Sakirat.
Yeah.
Yes.
Okay, Mr. Abraham, from your record, I understand that you came for removal as well as the cleaning of the side of the dressing. But before proceeding to the procedure, can I confirm if you have any doubts that I'm going to address? And I'm assuring you that I'm going to clear all those doubts to the best of my understanding.
Yeah, that's
Okay, Ram?
good. Yeah, next, Sharon. 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 Vijay. Vijay. Yes.
Mr. John, what would you like to tell me? I'm here to help you and also I will provide appropriate care for you. Is that okay? Okay, Mr. John, now I'm going to remove your stitches and also I will do the dressing for you. Is that okay? Are you feeling comfortable?
Yeah, that's very good, Vijay. You have done a good job. I really appreciated your, steadfastness. Very wonderfully you have presented. That's good. Okay. I was literally shocked at the
Thank
way
you,
how
sir.
you have spoken. That's really good. It's appreciation, real appreciation. I'm not praising you. It's a real fact. That's good. Do it. Next,
Thank you, sir.
Vinita Mol Ramakrishna. Vinita Mol.
Yes, sir.
Yes.
Is it okay? Now I'm going to remove your dressings and
Yeah,
I will
stop
do the
your
dressing.
video, Vijay, money and audio also. Once you finish, you stop. Yeah. Yes, Vinita. Start again.
Okay, sir. Before proceeding further, could you please tell me, do you have any confirm? Sorry, sir, I will.
Yeah, carry on, carry on.
Before proceeding further, could you please tell me, do you have any concern regarding your condition like squamous cell carcinoma?
Good. Next, Dr. Swati Manimoli. 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 Yogendra.
Mr.
Yes, it
Jones,
is your turn.
Mr. Jones, as per your case note, you have come here to removal of stitches. But proceeding further, could you tell me something regarding how you're feeling right now? Do you have any concern regarding your this procedure?
Yes, good. Good attempt. You're improving, Yogendra. Dr. Arshia. Dr. Arshia.
Yeah, based on your case note, I understand that you are here to remove your stitches. Afterward, I will clean your wound. Please ask me if any other concern are there with you. Okay, and I know that you have you know about the squamous cell carcinoma. Okay.
Yes, that's a good attempt. Next, Alinda. Alinda.
Yes, sir. From your case notes, I understand that you've come here for your wound dressing, suture removal. But before we move any further, can I ask if you have any concerns or worries that I need to clear before we move on to the procedure?
Yeah, note down this sentence. Before we move on, okay. So let me clarify, or can you please tell me? Yes, that was a good phrase there. You can note down. Can you repeat that phrase, that particular sentence, Dr. Alinda? Before
Can I
we
ask if you
proceed,
have
that
any?
sentence.
Can I ask if you have any concerns or worries that I need to clear before we move on to the procedure?
Yeah, that's a very wonderful sentence. Can you type that one so that others can also note it down? It's a very good sentence. It's a very good sentence. Next one. Yeah. Hafsa Fatima. Hafsa Fatima.
Yes, sir.
Yes.
I'll start now. I've got some notes regarding your visit. It's for stitches removal as well as wound cleaning, isn't it? So before we go ahead, I would like to know if you have got any curious regarding the procedure or any uncleared questions.
Yes. Next, Majid. So Alinda has typed the letter sentence for you. Do you have any concerns or worries that I need to clear before we move on to the procedure? That's a wonderful sentence, a great sentence. Note it down. Yeah, next, Majid, Rajni, Sharon, Manimoli.
Yes.
Yeah. Start your video, please.
Yeah. 1 minute, sir.
Yeah, carry on.
Hello.
Yep.
Yeah, nice to see you here in the clinic. I understand that according to the doctor advice, you are here to removal of suture and the redressing. Don't worry, make yourself comfortable. I'm going to arrange the things to use. Meanwhile, do you have any concern about this procedure?
Right, that's good. Manimoli. Yeah. So Anju Kumari, not available. Yeah. Right. So Anju Kumari, Majid, Rajni, Sharon, Dr. Swati, Simran. Simran.
Yes, sir.
Yes. Come on. Don't scare me, Simran. Come on, speak.
I have your goats, but perhaps could you please tell me in your own words what seems to be the problem?
Add 2 more sentences.
Mm. Okay, for my better understanding, could you please tell me some information regarding this?
Yes, that's very good. Now we are moving to the second point. Yes. Second point is here. Yeah. This is the second point. Yeah, prepare
Yeah, hello,
yourself,
sir.
all of you. Yeah, who is that?
Yeah, it's me, Sharon, sir. I
Yeah,
need to speak,
Sharon.
sir.
Yeah, you missed that one. I tried to call you 2 or 3 times. No problem.
Yeah,
Okay. Yeah, you can speak now. One
yeah,
second.
okay.
1 second. 1 second. Yeah, you can speak. Sharon.
Yeah, as I saw your doctor
Start your
notes,
video, please.
as I saw your doctor notes, I found that you come here for the stitch removal or the wound dressing. Before we moving further, may I know is anything bother you which I need to be addressed?
I need to address. I need to
I need
address.
to, yeah,
Anything bother you? Anything is bother you which needs to be addressed. Which needs to be. I need to address, but which needs to be
I,
addressed. That is different. This is different. Okay.
which,
Yeah.
yeah, okay, sir.
Anybody else? Dr. Swati, Rajni, Majid, Anju. Okay, fine. Muhammad Majid, is he there? Yeah, he's there. Why is he not speaking? Muhammad Majid.
Yes, sir.
You are not a new student, okay? You are not small child. Come on, open your video and start speaking.
Okay, sir.
Yeah.
I can see your case note. You came here for removal of stitches, wound, clean, healing, redressing. Am I right?
Am I right?
Before,
Very good. Very good. But you have
before
to extend
proceeding,
1 or 2 sentences.
before proceeding, may I know you have any questions to be clarified?
Before proceeding further, may I know, or can you provide me the information regarding, or can you tell me if you have any worries or concerns that are bothering you seriously, or something like that? Very good. That's a good sentence. Definitely. Next, coming to the next point. Yes. So here it is. Yeah. Second point is here. Yeah. Yes. Come on, prepare for 30 seconds. Make notes also, no problem. Yes, 30 seconds more. Give information about squamous cell carcinoma. Yes, your concerns are quite reasonable. They are quite obvious. I totally agree with the concerns that you have expressed so far. So I have spoken as a patient. That's finished. I did not speak, but you have to imagine that I have spoken. I don't mind. That's not necessary for you now. As a nurse, I'm really concerned. I agree. Mute. Somebody is open there. Mute all of you. When you're not speaking, when you're not. Yeah, Manimoli. So mute audio and mute video when you're not participating. Only when you're speaking, it should be there. Otherwise, there will be a distraction. Yeah. So, as a nurse, I really understand your concerns. And I appreciate that you have shared your worries. It gives me an idea, the real idea, for me to understand your existing condition. Not only regarding your squamous cell carcinoma, but how you are reacting to it. Yeah. Based on that one, I can give you solid suggestions. Yeah, first and foremost, let us be clear regarding what is squamous cell carcinoma. There are many different types of cancers, and this is one of them. It's a type, it's one type of skin cancer. You know, the main reason for this is being extremely exposed to sun and ultraviolet radiation, because of which the color gets discolored, the skin gets discolored. But no need to worry. Believe me, many people are facing this situation because surgery is very effective. The lesions will be removed. Cancer will be prohibited or contained, and it will not spread any further. It will be restricted to that area, and that area will be eliminated. So there is no scope of this cancer spreading to the other parts of the body. But the thing is, you have to regularly or a periodical basis monitor if you notice any patches on the skin, abnormality or discoloration. Then the very first thing you have to do is you have to contact your doctor, your physician, and inform him so that the action can be taken immediately without any further delay. The sooner this is observed or noticed, the better. Because, if you ignore it or undermine the development and you do not contact the doctor, then you will come to a stage where it will be difficult for the cancer to be treated. The sooner, the better. Once you notice such spots, you have to immediately inform the concerned authorities, get it tested, okay, and treatment started. Delay will lead to any lethargy or a delay or negligence will lead to serious consequences, which may be detrimental not only to your skin, but also to the very life itself. Precautionary measures. So you can speak volumes, but where you want to stop, how much you want to speak, that is it. I've given you many things. Okay. People don't have time. They'll come off and on and then go. See, I'm calling their names and they're not coming properly. Yes. I'm not giving sessions every day. No, at least one day I give sessions. Attend. Forget your sleep. Forget your everything. No problem. Yeah. Do not worry. So, periodic, regularly monitoring your skin for any transfiguration or transformation or changes or abnormalities is very important. And taking immediate action is of utmost prominence. On the other hand, if whatever the circumstances might be, ignorance will result in deterioration of the condition and going up higher the ladder and make it problematic, and the healing process may take more time. So nip it when it is in the bud stage itself. When it blooms fully, it will be difficult. So initial stages only, it's better to contain the growth. Okay. Otherwise it may spread further and the level may be higher and the healing process may be take more time, and the trouble you face will be increased. So there will be repercussions, multifaceted repercussions. So to avoid these negative aspects, probable negative aspects in the forthcoming future, better spontaneous but speedy actions are recommended. How does that sound? Then there is a complete sealing of the bond. Oh, no problem, everything is fine. How does that sound? I don't understand. What is that? How does that sound going to do there? After putting biryani, then you will seal it with flour. So that gas will not come out, the steam will not come out, it will be cooked inside. The water drops will not be wasted. Low water, moisture will be contained. So you'll seal it with that flour, wet flour, duff, we call it. So then you say, how does that sound? You did not do drama and you're asking for claps, like that it is. How does that sound means? How does that sound means? Applause. It's clapping at your performance. Okay. How does that? Wow. That is what applause. But where is that wow factor to make somebody feel wow? No problem. We are there, safe hands. Everything is good. How does that sound? That will not. So reassurance. Underline the word reassurance. You should make the other person feel that nothing is going to happen, and perfectly. Yes, that's it. So ready? Fast. Now we are going to do the speaking session. Yes, there you are. Right. Now number 1 is Anita Pachigola. It's better I take the doctors first because those sentences can be taken by, yeah, 1 second, Anita. 1 second, I'm sorry. I'm cutting you. Forgive me, I beg your pardon. Now let's take the doctors because they may give you some good sentences. Of course, everyone gives, no doubt. Yeah, let us start with Alinda. Dr. Alinda. Next to Dr. Swati or Dr. Arshia, be ready. Yes, Dr. Alinda.
Yes, sir. So, your concerns are totally valid. I can understand where you are coming from. If I were in your position, I would have had the same concerns. But let me answer your questions. Squamous cell carcinoma is a type of cancer which one acquires while the skin gets excessively exposed to ultraviolet radiation. And as you've already had the surgery, don't get overly concerned, as the surgery or excision of the site has halted the progression of the disease. And also, so can I have the view of the slide once?
Yeah, that's fine. Good. Can you recall your first sentence, please?
Your concerns are totally valid. If I were in your position, I would have had the same concerns as you.
Yes, that's very, I would have had. Very good. Yes. So, next to Dr. Arshia. I'm telling the doctor to speak first because those sentences, some of those sentences you can add to yourself. That's why. Yes, next to
Yes,
Dr.
sir.
Arshia.
So yeah, I understand your concern that you want to know about this squamous cell carcinoma. So I would like to tell you that first I want to give information regarding the type of, actually it is a type of carcinoma which is in its middle and outer layer of skin, and it is because of when you expose to a sunlight, it usually occur. And now no need of any, you know that many options are there for treatment for this type of carcinoma only you have to be careful about that. Whenever you see any lesion, uh, uh, go to the doctor for the further evaluation and management.
Yeah, very good. Now, the other students who have speaking sessions scheduled, you can go finish the speaking and come back. Only the thing is you have to just message me here. Yeah, Dr. Arshia. Next, yeah, Anita. Anita Pachigola.
Shall I start, sir?
Yes.
That's good. I'm glad you have asked me this, and I certainly understand that your concern is reasonable. And I would like to explain about your concern in very simple terms. Squamous cell carcinoma is a type of cancer which is caused by extreme exposure to sun and ultraviolet radiation, where your skin gets discolored. But however, do not worry about it. Many people are facing this and yet managing. You have underwent a surgery during which the cancer-causing lesions were removed, and now they're unlikely to spread to your skin and other parts of your body. In addition, I would like to add that you have to follow certain self-care strategies. Those are checking your skin regularly for any kind of discoloration and new appearances of patches. And if you find any kind of such symptoms, consult the doctor immediately, because if you ignore them or fail to contact the doctor, that will lead to complicated conditions and the treatment will be very difficult later. Hence, you are suggested to consult the doctor as soon as you identify certain symptoms. Is that clear to you?
That's very clear. Thank you. Next, Anju Kumari. Anju Kumari. Then Hafsa Fatima. Hafsa Fatima. Yes. Yeah, you can start.
You sound reasonable. It's worthy to be taking note of this. To improve the comprehension, let me enlighten you with the knowledge. So basically, squamous cell carcinoma is one of the types of skin cancer primarily caused by direct sun exposure, especially due to the ultraviolet rays. Nevertheless, you don't need to agonize as you have undergone the surgery, which removed the lesion, ceasing the outspread of cancer. So to maintain your aftercare health, so it's crucial for you to check on your, sorry for this, I don't remember yet, to check on your, the changes, like for skin monitoring. So if you find any changing spot in color or any outgrowth of some lesion or a kind of in a pimple formation, so it's better for you to consult doctor as soon as possible. Aside this, it's better for you to consult doctor for the regular follow-up.
Right. Next, Kamaljit Kaur.
Yes, sir. Okay, Mr. Sam, your concern is quite reasonable. It is understandable how you are feeling. If I were you, I would react in the same way. So let's discuss about what is squamous cell carcinoma. It is a type of skin cancer which is mainly caused by excessive exposure to sun as well as ultraviolet radiations. But Mr. Sam, don't worry, your lesions has been removed by surgery and there is hardly any chance of spreading of further cancer. However, it is quite necessary to monitor your skin on the regular basis for any unusual changes on your skin. If you notice any abnormality, please seek medical assistance immediately. Am I clear so far?
Yeah, of course. Right. Next, Majid. Muhammad Majid. Muhammad Majid. Next, Rajni. Yes, Rajni. Next, Rajeshwari. Rajeshwari. Rajeshwari Sarvagar. Sakirat.
Mr. Abraham, I understand your worries, but I want to assure you that every doubt is going to be clear. The main thing is how the carcinoma occur, and I'm going to tell you. It is the skin cancer you are having is one of the types of carcinoma that occurs on the skin, and it is as a result of exposure to sun and ultraviolet radiation. But with the step we have taken to remove your surgery, to remove your cancer now, there is no. I'm assuring you that there won't be any issue. In the sense that there won't be room for metastasis of the carcinoma. So we have done the justice to your problem. So apart from that, I want to tell you that you should keep to a regular checkup as recommended by your doctor, and also you should always monitor your skin. If you observe anything that is unusual, I want to tell you that you should not hesitate to contact us. And I want to assure you that we are always here to assist you. Is that okay, Mr. Abraham?
Yeah, that's very fine. I want to ask you one question.
Okay.
Because I have noticed it. Were you reading from the book or were you reading from your mind?
I'm not reading from book. I did not even jot anything.
That's what I'm saying. Nah? I noticed that you are not reading. Okay. I really appreciate you for your effort, sincere effort. Maybe you might have written some notes. That is second thing. But on the spot, you have spoken. Okay. Whether you're right or wrong, that is not a matter, but you have spoken on the spot without reading from anywhere. Really, I have to appreciate for you that. Yes.
Okay.
Then next, this is Sakila. Sharon. 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 And next, Viji. Viji. Yeah. Viji Anapuram. Vinita Mol Ramakrishna.
Yes, sir.
Akhil, those who have attended the full session and answered all the questions, arrange speaking session for them. Schedule the time and give me. I'll take their speaking session. Tell them, prepare this speaking session which they have done and take their time. Okay? Only for those students which tick everywhere it is there. For others, don't give. Yeah, Vinita, you can start.
Okay, Peter, I really understand your concern, but let me explain what is squamous cell carcinoma and what are the effectiveness of surgery.
Can you
Okay.
start your video, please? And start again. Restart.
Peter,
you are doing well. You are doing well. I am removing your fear. If you cannot open up here, you cannot open it in the exam hall. So I'm removing your fear. You will be dynamic, daring, dashing, courageous, and everything. Come on, start.
Well, Peter, I really understand your concern. Let me explain what is squamous cell carcinoma and what all are the effectiveness of your surgery and the importance of the monitoring of your skin. Meanwhile, if you have any concern, you can ask me. First of all, squamous cell carcinoma is a type of cancer caused by extreme exposure to ultraviolet radiation and sunlight. Okay, but in your case, you underwent surgery, so there is a less chance to spread another area. How does that sound?
Yeah, that's really great, nurse.
Okay, and moreover, it's imperative. Okay, keep in your mind, always check your skin. If you notice any changes or any irregularity, any spot, you can inform your doctor. Or moreover, you can make a regular checkup with your doctor. Could you do it?
Yeah, of course, nurse. Yeah, next, Dr. Swati. Manimoli. Manimoli. Yeah. Money. Come on. I cannot pronounce the South Indian accent, so that's why I'm cutting your name. Cutting short your name. Okay. So, yes, money. Next is Yogendra. Yogendra. When I pronounce the names wrongly, these people will start laughing. What to do? Yeah. Yogendra. Yeah. Vijay finished, right? Yogendra. Vijay, have you finished? No, not yet. Vijay Annapurnam. Yeah, you can start.
Mr. John, I do
One second,
perfectly
you start
understand.
your video also. Start your video also. When you come, you start your video. Yeah.
Shall I start, sir?
Yeah, of course.
Okay. Mr. John, I do perfectly understand your concern. See, let me tell you about this commercial carcinoma. This is also one type of skin cancer. It is caused by sun exposure as well as the ultraviolet radiation. Are you following me, Mr. John? Okay.
Yeah, nurse.
Mr. John, already you have undergone surgery. So your lesions were removed. So there is no need to worry. There is no chance to spread other area. Is it clear to you? Okay, Mr.
Of
John,
course.
Mr. John, I would like to tell you the importance of skin monitoring, and also you should check your skin every day if there is any spot or any discoloration. So you have to seek for the medical attention. Are you following me?
Yes, nurse.
And is there? Do you have any other concern, Mr. John?
No, nurse. Thank you for the information. Yeah. So next, so this is Vijay done. So once again, Anju, Majid, Rajani, anybody unmute and come up. Then Sharon, Dr. Swati, Mani, Yogendra, Simran. I call your names. Anybody unmute and come up. Rajeshwari. Yeah, Rajeshwari. Yeah, Mani. Okay, Rajeshwari. Yeah, start.
Yes.
Start.
I'm totally understand your concern, Mr. Lingam. Try not to be worried about that. You are in the right place, and I will give the more explanation regarding your condition. Okay. Firstly, let me explain what is the squamous cell carcinoma. Squamous cell carcinoma is the type of the skin cancer which caused by long-term exposure from the sun and ultrasound violation radiations. Is that clear to you?
Yes, nurse.
Okay. Okay. In your condition, I can tell you that you underwent the surgery very successfully. In that, they removed the lesions, and there is no chance of spreading the cancer one part to another part. All right, but you have to take you have to take it more important to monitor your skin. Okay, while checking your new changes in the spot and all. If you find any kind of these changes, you immediately have to seek the medical attentions, which will really going to be helpful for you and in order to prevent the further complication. Would you be able to do that?
Yeah, of course, nurse. Thank you.
Thank you.
Yeah. Next, Mani.
I totally concerned about your. I totally understand your concern about your disease condition. Let me explain about your squamous cell carcinoma. It is one of the type of skin cancer. It is caused by radiation and sun exposure. Don't worry about this. Now you had already surgery. The lesion has been removed, and then you are getting better now. Is it okay? And now I'm going to tell you about your further maintenance about your health condition. You have to observe your skin and monitor regularly. If you found any new lesions or patches, then you have to immediately contact your doctor. That will make your health condition to improve.
That's good. Next, once again, Anju, Majid, Rajni, Sharon, Dr. Swati, Yogendra. Yeah. Rajni.
Sir, yes, sir.
Yes. Yes, Rajni, you can start.
Mr. Peter, I understand your concern. Now I'm here to explain about your disease condition. About squamous cell carcinoma. It is one type of skin cancer. It is caused by exposure of sunlight and ultraviolet rays. Are you following me, Mr. Peter?
Yeah, of course, nurse.
For my notice, Mr. Peter, you have You have underwent surgery to removal of lesions and spreading parts. Now I'm here to explain about importance of monitoring your skin, checking of your skin, discoloration, any cuts and spots. You have anything noticing? You have to attend medical practitioner. For my concern, you have any doubts regarding your condition? What I explained now?
Yes, nurse. Thank you.
Thank you, sir.
Yeah, now we are going to another point. So 3 points are over. Fourth point. Yeah, fourth point is here. Yeah, you can prepare for 30 seconds. So he is going to request you for information about further surgery. Do I need to have more surgery again and again in the future? So can I talk to the doctor? Then you say, no need to worry about that. So far, so good. Everything is managed well. Surgery was performed and everything is clean now, as of now. So no need to worry about that. And there is no need to discuss with the doctor also because that is a clean sheet now. So no need to worry. But I want to know about your habits. Okay, what are you going to do in the protect you when you are walking in the sun? Do you use any sunscreen? And do you use any hat or something else? So how are you protecting yourself? Do you use an umbrella? Whatever. So this is how you are going to speak. Yes, Dr. Alinda. That's very disciplined. Yeah, carry on. The second I told Dr. Alinda, immediately switched on the audio. She started the video and she's ready to speak. That is what I want. And once the thing is finished, she immediately switches off the audio and she also stops the video. That's really very good. That is what I expect from everyone. Yeah, Dr. Alinda, you can start.
Sir, I didn't get the first point. Do I say that he needs to see a senior doctor?
Yeah, I'm telling you, for example, doctor, what about in the future? I may need some surgery, or it may spread, it may restart, or what am I going to do? Do you need more surgeries? How many times I have to take the surgery in the yearly once or monthly? What exact I'm going to do? Can I discuss this with the doctor because the doctor knows better? Now, what do you say? Like this, I'm asking. Now, give the answer.
Well, your concerns are totally valid. So, as I've already told you, in your case, surgery has already been done and the disease progress has already been halted. There is no chance that it might progress further. But as I've already told you, have to watch out for the signs as well. And apart from that, will it be okay if I ask you a few questions regarding your background, just to assure that you are? So while going to the sun, do you wear any sunscreen or anything like that?
Yeah, of course. I wear sunscreen 30 and above.
That is very good. And what about sunglasses? Do you wear sunglasses?
Sunglasses I don't wear.
In that case, I would advise you to get a sunglasses that will protect your eye areas as well. And what about hats? Have you been wearing hats while you go under on the sun?
Yeah, actually, the thing is, when I was young, I spent most of my time and I didn't bother about all these things. That's why I am punished and I am facing this problem, this bitter thing, the squamous cell carcinoma. And I don't have, now I'll be careful and I'll manage my situation.
That's really great. So I advise you to wear a hat as well. These things will protect you from getting any future chances of cancer. Is that okay? Are you following me?
Yes, that's fine, doctor.
Thank you.
Yeah, Dr. Arshia. Dr. Arshia.
Yes, sir. Yeah.
Yes.
So
Yeah, you can
I
start.
would like to tell you. Actually, I understand your concern, and now I would like to suggest you that now already your lesion is removed, so no need to worry. It won't spread at all. But the thing is that you have to take precaution in future. Whenever you will expose in sunlight, just to apply sunscreen, and better to wear sunglasses also, and hat also, so it will protect you from the sunlight. Okay. And any other concern are there with you want to ask?
Yes, doctor, what should I do now? What care should I take?
Yeah, that is the only thing, that whenever you expose to the sunlight, please be careful, apply sunscreen, apply your wear your sunglasses, and better to put on your hat, so that will protect you. And it's nice whenever you in future, whenever any other new lesion, you have to be careful and immediately report to the doctor. It's okay.
Yes.
Are you getting my point?
Yeah, that's fine, doctor.
Okay.
Yeah, next. Anita. Anita.
Yes, sir.
Yeah, immediately be ready, all of you, okay? Be ready. Who is speaking before you? Immediately, one by one, I am calling. So be ready.
Yeah.
Yeah, come on, start.
Well, Mr. John, I understand your fear about need of further surgery, but I would like to tell you that the surgery has been successful when you underwent, and you're perfectly doing all right. So far, so good. So there's no use of further surgery. But I would like to ask you, would you mind elaborating me more about your habits when you're performing your outdoor activities, such as while you're doing outdoor activities, are you using any sunscreen lotions or moisturizers, hats, or wearing an umbrella, or are you wearing full sleeve clothes?
Yeah, of course, nurse. I'm following all these things, whichever you ask, except full sleeves, because I'm not used to that.
Mr. John, it's good to know that you're following many of the strategies, but I would like to suggest you that it is better you wear full sleeves too. That will protect you from overexposure to sun. Is that okay to you?
Thank you very much. Yeah, next, Anju. Hafsa Fatima. Simon sir has no work. He will be there. Students have work, so they'll just go off. Yeah, lot of work they have. Yeah, come on, next. Is that Hafsa Fatima? Are you there? Yeah, next. Kamaljit Kaur. Kamaljit Kaur, not there. Right, Majid. Mohammad Majid. Rajni. Rajni.
Yes, sir.
Yes, start.
Yes, sir. Okay, Mr. John, now I'm here to explain about your further information about your condition. Mr. John, you don't need to have any further surgery. It is not required for you. When you're exposing sunlight, you have to apply some skin lotions, wear sunglasses. You're finding any apart from that, you're finding anything, you can consult a medical practitioner.
Yeah, thank you, nurse.
Okay, thank you, sir.
Yeah, next. Rajeshwari.
I'm really understand your concern, Mr. Lingan. Try not to be worried about the further surgery. And I'm sorry to tell you that I'm not the right persons to tell you if you need further surgery or not. But I will make an appointment with your doctor. You can speak with him and he will give the more information regarding the further surgery. Is that clear to you?
Yeah, of course, nurse. That's absolutely
Okay.
fine.
In order to get a clear picture about your habit while you are under the sun, I would like to gather some more information from you. Is that okay?
Yeah, fine, nurse.
Okay, can you please tell me while you are under the sun, are you using sunscreen, hats, and full sleeve dresses?
Yeah, I am following all these things, right?
I'm glad to hear that, Mr. Lingan. You have to be follow the same thing. Thank you.
Yeah, Sakirat. Sakirat.
Yes, sir. Yeah. Oh, Mr. Abraham, I understand your doubts. And I want to assure you that it's nothing to be worried about because necessary intervention has been carried out and you are making a progress. So you don't need any further surgery. Is that okay?
Yeah, that's okay, nurse.
Okay, thank you. So I want to ask you your habits. May I?
Yeah, of course, nurse, you can.
Can you tell me your habits when you are under the sun? How you protect yourself? Maybe you put on anything to protect yourself?
Yeah, I am wearing 30 power sunscreen lotion, 30 plus.
Okay. Okay. So that's fine. Keep it up. So apart from that, I want to encourage you that whenever you are under the sun, you always put on your sunscreen as well as your hat to protect you from further cancer. Is that okay?
Yes, of course.
Yeah. Thank you.
Right. Next, Viji. Viji. Last two questions are there. Come on, fast. Students also minimize, so we'll finish everything fast. Viji. Next, Vinita. Yes.
Okay, Peter, I acknowledge your concern, but yeah, I'm not the authorized person for tell about your further surgery. But it's beyond my scope. But you don't worry, I will make an appointment with your doctor. Okay, you can discuss with him. He will give a proper information regarding your surgery and everything. And can I ask a few questions regarding your personal habits? Is that okay for you?
Yeah, nurse, definitely.
Okay, okay. I would like to know about have you used sunscreen and hat whenever you expose the sunlight?
Yeah, of course. I follow all these precautions, nurse.
Oh, I'm glad to hear that. Okay.
Right. Next, Dr. Swati Manimoli. Mani. Then Yogendra. Dr. Arshia Simran. Yeah. Yes. Anybody who did not cover this one? Let me check once again. Anju, Hafsa Fatima, Kamaljit Kaur. Kamal is here now. Yeah, Kamal.
Yes, sir.
Yeah. So this is regarding sunscreen and other things. So are you
Okay.
ready for this?
Sir, can I prepare for 2 minutes?
Yeah, okay, fine. So this is the card here. This is the fourth question. Request information about further surgery. Resist request. Mansi Dukonde. She came now. Yeah, you can participate, Mansi. So get ready for the next question. All the others. All others. 1 second, 1 second. All the others. So prepare for the next question. This is the 5th question. All others. Yeah. So now, stress need for ongoing prevention, continuing to cover up in the sun, prevention of further damage, find about the patient's wound post-surgery, any pain or discharge, anything, etc. Yes. Yeah, you can start now. Kamal.
Yes, sir.
You can start your video.
Okay, Mr. Sam, I really understand your anxiety regarding your condition, but I'm so sorry to tell you that it is beyond my scope to tell you about the further surgery. It is the doctor's duty to tell you exactly about the surgery. So whenever doctor will come, you can share your concern with him. Okay, but Mr. Sam, it is quite necessary to apply sunscreen whenever you go outside, and wear your hat, which will protect you from the sunlight and radiation exposure. Are you getting my point?
Yes, of course, nurse.
Okay. Okay, thank you for accepting my suggestion, Mr. Sam.
Yeah, that's fine. So now next round, all of you can participate again. I'm giving you 30 seconds to prepare this question. All of you. Yeah. Not complete role play card. Question after question we are doing, Mansi. So here it is. This is the question. Stress need for ongoing prevention. So no need to worry. Now what is the most important thing that is to be considered? Let me tell you. Now prevention, you have already faced this problem and we do not want this to recur. Reoccurrence is not expected. So for that one, what we are supposed to do is prevention. Prevention is the best possible. So after getting the disease or problem, curing is difficult. But before that one only, if we take the measures for preventing this again. So what are the steps for prevention? First and foremost, whenever you go in the sun, it's always necessary that you cover up yourself entirely so that the sun's rays do not fall directly on your face or on your skin or any part of your body. Yeah, the neck or anything which is exposed to that. So try to cover your body so that the sun's bright rays will not be directly approaching your skin under any circumstances. So take all the precautions because already you have this problem and your body is, prone to this sickness. So it's better take prevention. So what are the things you can do? You can be ducked under an umbrella, or you can put a coat or something like that. Use a hat where the neck and everything is covered, and wear full sleeves and use some gloves. Okay, wear socks. So wherever the body can be exposed to the sunlight should be taken care of and be covered by all possible means. Okay, there is no excuse for this situation. And then so this is the way how you can prevent your skin from further damage, And what about your post-surgery condition? Do you feel any pain? Is there any discharge? Are you facing any other, any anything? Can you tell me, please? I would be happy so that we can assess your wound condition. Yes. So this is the way how you can speak. Now let us start with again Dr. Alinda. So very good, Dr. Alinda. You are very obedient. You need not attend. Many people think that they need not attend this session, but still you are there. It's a nurse's card, but you're learning a lot of things. And this is not a nurse or doctor or a physiotherapist or something else. It is English. That's it. That's it. That's it. Yeah, you can start. Dr. Alinda. See, many nurses are there. They will come and they will go. What to do? See, being a doctor, she is there from the beginning to the end, and every question she is answering. Same is the case with Dr. Arshia. Okay. I told them, this is for you. They came, they are attending. Huh? But our nurses, see, some people are coming and going. Right. Okay. Yes, you can start. Yes, please. Dr. Alinda. You cannot unmute or what? You can unmute.
Sorry, sir. I thought I already.
Yeah, no problem. Carry on.
Okay, so Mr. John, as you already had a type of squamous cell carcinoma in the past, it is imperative that you prevent exposure to the sun in the future. So for doing that, what you can do is you already said that you've been using SPF 30 for the as a sunscreen. I suggest you to use SPF 50 plus to provide extra protection to the skin, and also wear hats or umbrellas wherever you go. And also regarding the wound healing process, will it be okay if I ask you a few questions to get a better idea?
Okay, that's very good. Thank you very much, doctor.
No problem.
Are there
Is
any
there
more
any
that you want to give me?
Yeah, you need to minimize exposure to the sun by carrying sunscreen, sorry, wearing sunscreen, umbrellas and gloves, socks wherever possible. And also you need to watch out for signs like any new lesions of the skin, or any abnormal growth or things like that. And if you notice anything like that, you need to go to the doctor as soon as possible.
Thank you very much, doctor.
No problem.
Yeah. Next, Dr. Arshia.
Yeah, hello. I understand your concern. See, now already you are exposed to the sunlight and you got lesion. So now your experience. In future, you have to precaution. If you feel any changes in the skin or any lesion, you have to approach the doctor as soon as possible. And I would like to suggest you that whenever you go outside, you cover your skin properly with sunglasses, or you have to put your hat and you use umbrella. It's good for you, because I want to suggest you that already you exposed, it means that you already got the lesion. You already, so you are in future you have to take precaution. Are you understanding me?
Yeah, of course, doctor. Is there anything else that you need to suggest me?
Only the thing that already damaged, you got damaged your skin. So the need is now is you have to take, whenever you go outside, you cover your body properly. You apply the sunscreen, and you just put your sunglasses and keep your hat on, and you just better to cover your body. It is very essential for you. Okay, I think you understand the concern.
Yes, doctor. Next one, Anita.
Yes, sir. I'm very happy to hear that you have been following all the preventive measures so far. But however, I would like to still remind you for the need for ongoing prevention by continually covering yourself when in sun, which will enhance prevention of further damage and all the other complications. As you know, prevention is better than cure. And what about your current condition after surgery? Are you experiencing any pain or discharge from the surgical site?
No, nurse. I don't feel any pain and there is no discharge. But I think it is not right time. I think we need to wait for some more time before. Yeah.
Well,
Next, Anju Kumari, Hafza Fatima. Hafza Fatima, you already missed one question. Yeah. Are you ready, Hafza Fatima? Okay. Then next, Kamaljit Kaur.
Yes, sir. Okay. Okay, Mr. Sam, I appreciate that you are following the precautionary measures. So it is
Video.
quite.
Can you switch on your video, please, so that you can see your performance later? Yep.
Sir, actually, sorry, my phone's battery gone, so.
Okay, fine. No problem. Carry on.
Okay. Okay. Okay, Mr. Sam. Yeah. I appreciate that you are following the precautionary measures. Yes, it is quite necessary to continue to follow the precautions. Always remember, whenever you go outside, cover your skin, which will help you to prevent for the further damage, and it will enhance. Sorry, sir, I stuck it.
Yes, those who are participating in the speaking sessions with Priya and Reshma, you can go finish and come back. Yeah, next, Kamal, you can prepare yourself. Next, Majid, Rajani, then Rajeshwari. Rajeshwari. Sakirat. Sakirat.
Okay, sir.
That's very obedient.
Yeah.
I like you,
Yeah.
Rajesh. I like you, Sakirat. You're very excellent.
Okay. Mr. Abraham, thank you for your information. And I'm glad I'm glad to hear about your habits, but I want to still tell you that you should keep it up, and to prevent future occurrence, I mean, you must ensure that you are protecting your entire body, including your eye, with sunscreen glasses, as well as a glove for your arm and every other part of your body. So if you do all these things, I'm assuring you that there won't be further occurrence. Is that okay?
Yes, of course, nurse.
Yeah. So I still have some other questions to ask you. May I?
Yeah, nurse, definitely.
Okay, thank you. So about your wound, are you still observing any other thing, like maybe pain or pause from it?
No, nurse, there is no pain, there is no discharge also. So, but still, I think it is time. It's not time for us to remove this.
All right. So okay. So is there any other thing you want me to address?
That's fine, nurse. You have cleared me all the doubts. Thank you.
All right.
Yeah.
Thank you.
Next, who is there? Yeah, Mansi. Mansi.
Hello,
Yeah.
sir. Good morning.
Yes, you can start.
I am really glad that you are following all the precautionary measures, but I would like to add some more point in it. Is that okay for you?
Yeah, of course, nurse.
Yeah, I wanted to tell you that whenever you are going outside, you please cover, like you wear a full sleeves clothes, wear a hats, and as you already told that you are using a sunscreen lotion, that's really great. And please take care when you are going out. You please carry umbrella. Are you getting my point?
Yeah, of course, nurse. Thank you very much. Is there anything else that you want to suggest me, nurse?
Yeah, secondly, I want to ask you, like, about your surgery. Could you please explain me about your surgery incision? Is it okay? Is it healing, or is that giving you any trouble, like pain, redness, or any sort of abscess? Is there?
No, nurse, that's quite fine. Everything is clear.
Okay. If you notice anything, please contact to us.
Yeah. So next one, Who is that? So Vinita Mol Ramakrishnan.
Thank you, sir.
Vinita Mol, you can mute and stop your video. Vinita. Yeah, you can start your video. Vinita completed all the questions. Very good. Vinita.
Sir.
Yeah, start your video, please. Vinita Mol. Yeah.
Sir, I can't open the video.
Now you can, I think. Check it out. Yeah. Yes. Okay. Yeah, you
Okay,
can start.
sir.
Yeah, you can start now.
Okay. Well, Peter, I totally understand your concern, but I would like to give one correction in your thought because past is past. But I strongly recommend you to follow our instruction wherever you go. Apply sunscreen and wear hat and covering cloth. That is beneficial for you, so we can avoid further damage. Is it clear?
Yes, of course.
Okay, so I would like to know about your wound. Do you have any pain and discharge from your wound side?
No, nurse, there is no pain and no discharge.
Okay, that's good to hear that. Do you have any concerns?
No, nurse, but I don't think it is the time for us to remove the stitches. What do you say so?
Can I answer?
Yeah.
Okay. Actually, I really understand your feelings, but you don't worry. I would like to tell about, the typical time for stitch removal is 7 to 14 days. In your case, you don't have any pain and you don't have any discharge from your wound side. As evidenced, there is this is the right time to remove the stitch, because if you are not remove the stitch at this moment, maybe there is a chance of infection because the skin is overlapped your stitches, so which lead to further complications. So in order to avoid this one, this is the ideal time for stitch removal. Are you getting my point?
Yeah, of course, nurse, I can understand now. Thank you.
Okay, so Mr. Peter, this keep in your mind, it's imperative. Okay, always keep your wound is clean and covered it dry. Are you with me?
Yeah, of course, nurse.
Okay, so Peter, shall I proceed the dressing stitch removal? Is it okay for you?
Yes, nurse.
Okay, thank you.
Right, next one. Anita finished. Alinda finished. Arshia, Hafsa. Hafsa, are you there? Rajeshwari finished. Redmi. Redmi is this Redmi? Rajini. Rajini, are you there? Yeah, Hafsa is there. Yes, Hafsa. You can start.
Yes. Okay. I'm pleased to know that you have been practicing preventive measures. As you mentioned, sorry?
You can start your video.
Oh, did I not? Okay.
Yeah. I'm making everyone a habit. Okay, come on.
I'm pleased to know that you have been practicing preventive measures. As you mentioned, you were exposed to sun extremely. So it's vital for you to continue taking those measures as well as adhere to cover up yourself when you're under the sun. So it will halt the further damage. If you're fine with this, then can I know? Sorry about this. Can I know if you have any concern related to post-surgery, like any pain or discharge from the wound side?
As of now, there is no pain. There is no discharge either.
All right. Thank you for the information. Okay, so as you mentioned just now, you have no discharge and pain. So I believe it's the time for us to remove the stitches because it's appropriate now, and the wound healing is perfect, which is also assessed by the doctor. As the removal of sutures will usually takes place around 7 to 14 days, and you have completed that period. So I believe it's the perfect time for the suture removal. Is that okay for you?
That's fine, nurse. Thank you very much.
Okay. So I would like to invite you aftercare of suture removal. That's keeping the wound clean, covered, and dry to minimize the complication of infection. So it's imperative you follow these measures. So I would like to obtain consent to remove sutures. Would you let me do it?
Yeah, but I don't think it is time for us to remove the sutures. Can't we wait for a little more time, nurse?
Well, for this, your doctor have already assessed your wound, so he advised you based on the results. So it's perfect time for the removal, and you don't have any pain or discharge, so there will not be any more complications.
Yeah, that's fine. Thank you very much. So Anita, Anshu, Kamaljit. Yeah, Kamal. Kamal is not there. I think she has problem with network. Yeah, then Majid, Rajni. Rajni. No. Then Sharon. Mani. No. Mohammed Majid. Are you available? So I think you're passively listening. Okay, no problem. Let me know. If you're interested, you can say I'm ready. Next, Simran. Yeah, finished everyone. Next one is, next question. The next question is, Akhil, I need a favor. Those students who attended, take time from them. Okay, the same time. But they will come, finish the speaking and go. Tomorrow we'll give a new card. Okay, take card number 4. Official card number 4. Remind me, I'll give you. So take the timings. Okay, we'll start. What time did we start? 2 o'clock, right? So 2 o'clock we'll start. Give the first 2 o'clock timing for from on doctors onwards. Doctors card, doctors. Nurses card, nurses. Give them the card right away. Today evening itself. And first you give it to doctors one by one. They'll come, finish and go. They'll need not wait. Those who want to wait, let them wait and learn. But there are some people who are going off and on. At least they'll finish their speaking practice. Full. So give 2 o'clock for who is this girl? Alinda. Okay. Then 2:15, Arshia. 2:30, Swati. 2:45, Dr. Naresh Gulati. 3 o'clock, Dr. Rani, like that. Okay. Give the first slots to doctors and then next slots to nurses. Take their consent first. Take their consent and ask them and make a note of it and prepare the plan. 2 to 6 o'clock, I'll take as many as possible. So 4 into 4. 16 speaking sessions I can take. There are only 16 here. Okay. So I can even hurry it also. No problem. 5-minute speaking session. 50, another 4 or 5 minutes feedback. So I'll take also a little bit rest in between when I change the videos. No? So ask them timing. So get it confirmed with these doctors and nurses and fix the timing and give. Okay. Before you leave. 6 o'clock you leave. No? Before you leave, send all the doctor's cards and nurses cards. Okay. Yeah. Next. This is the 5th question. Last question. This is the last one. So prepare. There is nothing to worry. You say that time is not ripe enough and we have to wait for some more days until we remove. So give it a time to heal it fully. But let me tell you frankly, the doctor has already decided, and actually, normally or typically or generally or usually, we need just a week or two, or 7 to 14 days for totally healing, total complete healing. Wound healing will be done within this time, and the assessment is also complete, and it is perfectly fine, and you are removing them safe and sound. Everything is good. Rest assured, we can go ahead with the removal of stitches. No doubt regarding that. And now I'm going to talk to you about the aftercare. Now after removing, be very careful. Now it is still fresh, so keep the wound clean and dry and covered, and don't expose to the sun too much. And yeah, right? Would you give me your consent to remove the stitches? Yes, I do. Nurse, thank you. You can go ahead with the things. Okay. So that is the point. Yeah. So let us start. Dr. Alinda.
I think your concerns are totally valid, but let me explain it to you. Your wound looks totally perfect, and the edges of the wound have approximated very well. So we can do the stitch removal by this time, and anywhere in the world, the stitch removal time is the same. It's 7 to 14 days according to the progress of the wound healing. And by looking at your wound, we've decided that the wound looks perfectly fine and it's the right time to remove the sutures. And regarding the aftercare of the wound, I would like to give you some advices as well. What you'll have to do is you'll have to keep the wound very clean and make it as dry as possible. And if you notice any discharge or anything like that, you'll have to come to us back just to assure that there is no signs of infection or anything like that. And in the meantime, if you face any difficulty or anything, then you can come back as well. And now can we move on further for the removal of the sutures?
That's fine, doctor, because you have decided and you know the better things for me, so I cannot go beyond your reasonings. I had a little doubt and you clarified it. Thank you, doctor.
No
You can go,
problem.
teacher. You can go ahead with the removal of sutures.
Okay, thank you. We'll remove the sutures now.
Thank you very much for giving me your consent. I really appreciate, and you respected my suggestion, so I'm proud of you. Yeah, that's so nice of you. Something you have to make the patient
That's so
happy.
nice of you.
You have to put that patient into your pocket.
Mm-hmm.
You don't have pockets. Put him in your
Yes,
pocket.
I do.
Yeah, next, Dr. Arshia.
Hello. After examination, I assure you that your wound is healed properly. And I think better we move on for removing the stitches. Okay. So I would like to tell you the aftercare of the wound. See, whenever you expose to the sunlight or you go out, cover it properly and take always cautious about whether any discharge or pain or redness is there. If it is, please come back for follow-up. And in future also, you have to take precaution like that only. Okay. If you don't mind or if you allow me, better we go for the stitch removal. Uh, okay. Then cancel. It's okay.
Yes, that's fine. Thank you very much, doctor. You are better, so you will suggest me the best. So I am confident in you. So let's move ahead and we can remove the stitches.
Yes. Thank you.
Yeah, next, Anita. That's
Yes,
good.
sir.
You are ready.
That's great to hear that you have no pain, no signs of infection such as like discharge. And there are two reasons for your suture removal today. The doctor has assessed your wound and you're doing well. You're progressing well and your wound is healing. And generally, suture removal is done within 7 to 14 days, and it is the right time for you to undergo this suture removal. But however, post care after suture removal is very imperative. So make sure you wash your hands thoroughly before and after touching the wound and surgical site. Keep the wound clean and dry. Make sure you wash the area with soap and water and do not expose this area to infected air or under sun. Also apply the prescribed ointment which is given to you now. And thank you very much for listening patiently for all the instructions that are given. Would you mind giving me the consent to go ahead with the suture removal?
Yeah, definitely. Thank you very much.
Thank you, Mr. John, for patiently listening and giving your consent to me. And I'm very happy that you have been following all my instructions. Thank you.
Yeah, tell Dr. Alinda to rejoin Akhil, because last conclusion part is there. She thought that everything is finished and she left. Yeah. So next one. Who is the next one? Hafza Fatima. Hafza Fatima. Last conclusion is there. Sir wants you to join. Finish it up. Another 5 minutes, please. Yeah, Hafza Fatima, are you ready? Then Mansi. Yeah.
It is good to see. It is good to see you and hear you that your wound is recovering well and it is healing. According to our record, it is the time to remove your stitches. But before removing stitches, I want your concerns for that.
Yeah, definitely, nurse. Thank you very much. I give you my consent.
Okay, Mr. Peter. After removing sutures, I wanted to suggest you some 2-3 points that you have to follow to avoid further infection to your wound. Is that okay?
Yeah, of course. Thank you once again.
Firstly, whenever you want to clean your wound, before cleaning your wound, you have to wash your hand, and after that, you have to clean and apply the ointment which doctor will prescribe you. Then you have to wash your hand, and whenever you are going out, you just cover your wound. Okay?
You're right. Thank you for your valuable suggestions.
Do you have any other concern about your care?
No, nurse. Thank you. You have cleared all my doubts, and I don't have any more.
Thank you, Mr. Peter, for listening me carefully and calmly. If you have any other concern, please come back to us. We are here to help you out.
Right. Next one is Sakirat. Sakirat Yusuf.
Okay, thank you, Mr. Peter. I want to tell you the reason why we have to remove your stitches is basically because your recovery, and not only that, the doctor has assessed your wound and he has certified us to remove your stitches. So we'll go ahead to remove it. Is that okay by you?
Yeah, of course.
Yeah, so Mr. Peter, I have some suggestion for you. So I want to suggest to you that you should always keep your wound clean. Not only that, ensure that your wound is dry and do not expose your wound. Is that
Okay, nurse, I'll follow your suggestions. Is there anything else that you need to tell me?
Oh, all right. Thank you for your cooperation since when we have started. So I want to go ahead with the stitches remover. May I?
Yeah, of course. Definitely.
All right.
Yeah.
Thank you.
Last part. Hafza Fatima, you want to say? Then we are moving to the conclusion part. Last one. Hafza Fatima. If you are ready, you can start. Hafza Fatima, call 2. Hafza Fatima, final call. Yes, we are moving to the last part. That is conclusion. closing the seal, final word, partaking, leave taking, thanking, and everything. So now we'll start with Dr. Alinda. Yes, Dr. Alinda, it is your turn. Yeah.
So, Mr. Joan, to summarize,
It is very important point. This is very important point. So that's why I did not want you to miss because.
okay, no problem. So to summarize, you had a surgery for a condition called as squamous cell carcinoma, and as you already underwent surgery, the chance of recurrence is very low. But you'll have to take care of signs like any abnormal growth in your skin or any lesions or any abnormal things going on with you. Then in that case, you'll have to go to your doctor as soon as possible for further reassessment, and also you'll have to wear sunscreen and hat and whatever to cover up your skin while going under the sun. And apart from that, yeah, your wound looks completely perfectly healed, and we can remove the sutures now. And if you notice any discharge or anything like that from the wound, then don't hesitate to come back. We'll be very happy to have another look. And in the meantime, if you have any other concerns, do not hesitate to come back as well. Is that all right?
Yeah, of course, Doctor. Thank you very much. I really appreciate your kindness and concern. Thank you.
No problem. Take care. Get well soon.
So you can leave. I'm very proud of you. Okay.
Thank you.
So you are very obedient. You'll go a long way. Okay.
Thank you.
So you'll oblige readily for everything. You went off, but when I called you, immediately you came. That's the spirit. See, many students, you have seen 20 to 30 students came and they went in between. They don't know the value of today's lecture. Actually, they don't know. They think that Simon sir has no time and he sits because he has no other better job, but he doesn't know. Training you people is the most important job for Simon sir. They don't know. So they don't even regard that things. They won't finish in a nutshell. And such people, it will be very difficult to handle. And I face a lot of problem in these things. Yeah, I prefer serious students who are obedient and hardworking and attend the sessions, so they can clear it in the first instance only. Yeah.
Yeah, is the conclusion okay, sir?
Yeah, that's fine. But a less of regurgitation and more of thanking the patient. Yeah, to tell you frankly, you have come with some doubts regarding this carcinoma, whether you get it or not, and I hope, I believe that I have given all the necessary information related to your doubts and clarified all the doubts possible. But still, if you have any concerns, you can ask me, and if not today, anytime, you can just pick me up, or you can contact the doctor, or you can visit the hospital. By anyway, anytime you have, we are always ready for you with the required information, and we are ready to support you. So you can approach us at any time. And thank you for patiently listening to me and accepting our suggestions and implementing the follow-up action for everything from the bottom of my heart. I thank you. And yeah, I believe that the recovery will be faster than expected if you comply with the regulations and the recommendation provided. Mind you, it's very important that you have to take the first prominent role. It is you that is required to take action. Okay, unless and until you cooperate with this, okay, the healing process will be, longer than expected. So, right. Is that clear?
Yes, sir, clear.
What all you have already spoken, minimize that one because it will be repetition. That is also okay, but in a different way you can tell, not the same things as they are. Okay? In a different. Right, that's the end of the session. You can leave. Next to Dr. Dr. Arshia.
Yes, sir. So I would like, last in a nutshell, I would like to explain you points. As you know that you already, it's very glad to hear that, and you already followed and our suggestions. So today, in last, I would like to tell you that See, now already we are removing your stitches and it is healthy. In future, if you feel any new growth or new lesions and any changes in your skin, you have to report as early as possible. And whenever you go out, so you have to take precaution that you already we explained to you. And I hope that you understand all you understand and you follow those points. Okay. And I'm really glad that you cooperated us. And now this is a leaflet, all the information regarding given squamous cell carcinoma and related to all information are given in this. And if in future you any problem, we are here to help you. And we are thankful that you followed. And in future, if anything concern will be there, so we are here to help you. I hope I have cleared all your doubts.
Yeah, thank you very much, doctor. That's really kind of. Thank you.
Thank you so much. I wish you a speedy recovery. And in future also, you have to be careful. Okay. And no need to worry at all. Thank you so much.
Okay, you can reduce the number of OKs.
Okay. Yes, sir. Yeah.
The number of OKs. Yeah, next one is Anita.
So far, we have discussed about what is squamous cell carcinoma, how it is caused, and what are the symptoms that you experience, and what are the preventive measures that are taken to prevent further complications and damages to you, and also post-care instructions after suture removal. I hope and I believe that I have cleared all your doubts and concerns related to this. And if you have any further queries or concerns, do not hesitate to contact me. If not today, anytime you want to. We are here to help you and wish you a speedy recovery.
Yeah. So next, who is the next one? Hafsa Fatima. Are you okay? Hafsa Fatima. Yeah, go ahead.
To conclude today's discussion, we talked about the cancer you had. In addition to that, the extra measures you need to take to minimize the complications, such as application of sunscreen moisturizer and covering up when you're under the sun. And lastly, the state of your wound favors to remove the sutures. So, like I have also obtained your consent to remove your sutures. And at the end, I hope I have explained to you in an understanding way. So if you still have any other questions, you can always come to me. Or if you still have any questions, please share with me.
Yeah, thank you very much, nurse. I really appreciate your care and concern. Yeah. Next, Mansi.
Good, sir.
Yeah. Mansi.
I believe that I have gave you all the necessary information about your condition, and I hope you understand my suggestions. But still, if you have any other concern, please feel free to ask me. And I am thank you that you answering my questions as well. And I wish you a speedy recovery.
Yeah. Very good. What's this? Kim, give Mansi for Priya ma'am. Add one number for Mansi. Priya ma'am, she'll do speaking regularly, okay? Request for evening, she may accept. So you can do 2 speaking sessions with Priya ma'am every day. Yes. You can add her in the Mansi's group. If you are not the admin, tell me, I'll make you admin. You are not admin, okay. Come to my tab and you can add admin yourself there. Right. So, Sakirat Yusuf.
Okay.
You come to your session.
Yeah. Mr. Peter, to reiterate what I've been saying so far, I told you that I explained the type of cancer you are having, being the skin cancer, and I told you that the rate of reoccurrence of the cancer is very, very low because you have taken the necessary intervention. And not only that, I told you that because you are always adhered to the preventive measure, that there is going to be a reduction in the future occurrence. So not only that, I still suggested that for the healing process to go smoothly, you need to ensure that your wound is clean and dry, and you shouldn't expose it. So with all that, I'm very sure that I want to assure you that everything is going to be all right. Is that okay? Is
Yeah,
that okay,
that's
Mr. Peter?
very much. I really appreciate your care. Thank you.
So I want to check your level of I want to check if you have understand everything I've been saying so far.
Yeah, thank you very much.
Yeah, thank you.
Yeah. Akhil, take a photo of this page and put it in the group, in the Telegram also. Yes, make it a regular habit. Yeah. So that's the end of the session. And if anybody is interested, from tomorrow onwards, it will be individual sessions. The timing will be, you can discuss with Akhil and he will give you the time slots. Okay. It may be flexible. If one finishes fast, I can pull you a little early also. So be available. Okay. So we'll start at 2 o'clock tomorrow and we'll be finishing by 6 o'clock. We'll finish all the speaking sessions. That's it. Thank you. See you again. Have a nice day. And Dr. Arshia, can you share your experience, Dr. Arshia? How was the session? How did you get the benefit? What did you learn today, Dr. Arshia? Dr. Arshia, are you there? Okay.
So,
Yeah, you
okay,
can
sorry,
share your
sir.
experience.
Some
You can
problem.
start.
Actually, I was closing only. Yeah,
You
so,
can
it is very really, it is very interesting and
One second,
very
one second,
beneficial.
one second, one second. You can start your video, please.
Okay, sir. I was muted. Yeah. Hello.
Yeah, you can
No
start.
problem. Yes, sir. Actually, this one is really very beneficial, and you are devoting this much. It is really, I appreciate that. So I respect for that, sir. And we learn a lot. I think everybody, uh, uh, I know that everybody means in their hearts only real gratitude and respect for you that you are devoting that. So, inshallah, I hope that everybody will pass with good numbers only after this much doing hard work and devoting, because you know that no, sir. What all the words from my heart only. That is what I'm saying.
Yeah, thank
That.
you very much.
Thank you so much.
Yeah. Yeah. So, right, Sakira Yusuf, can you share your experience?
Oh, my experience so far is I want to thank you for your time first and foremost, and with this session I've learned a lot from it. At least my level of courage has increased, I must confess. So thank you very much. Thank you very much, sir.
There are some students who are thinking, why sir wants me to come on the video? Oh, I'm scared, I'm afraid. If you are afraid here, then how will you go to the exam? Huh? Correct?
Yeah.
Now it is daring and dashing. Right. Next, Anita Pachagola. Share your experience, please.
Good evening, sir. That's really nice, wonderful session. It was like almost I had an experience. I experienced like I'm in a real role play card. I was using real role play card, but I had much time to prepare and talk. This is really good experience, sir. Thank you.
Right. Next, Hafsa Fatima, last but not the least. Yeah, you can share your experience.
It was really excellent. I must say that because for me, it's a kind of fear to face someone face to face. So I would say you are helping me in eliminating that.
Yeah,
Thank you
that's
so much for that.
yeah. So thank you all. Have a nice day. And here is our contact number. You can contact me here. And this is the number. You can contact me here. And WhatsApp.me 919877867360. So 91 is the country code. You can just take this number if you are in India. Otherwise, if you are abroad, it will be +91. You put a plus, and you can save my number and you can contact me on WhatsApp for regular sessions. So tomorrow's session start in the afternoon 2 o'clock. Have a nice day. Bye bye.